For my Girl Scout Gold Award project this year, I wanted to impact the lives of children and their mothers and families in less developed countries. This is how I chose the topic of clean water and helping maternity waiting homes in Africa. In Africa, clean water is hard to come by without using new technologies and items to clean their water. Water cleanliness also impacts the health of mothers and the lives of their children while they are pregnant with their children. This can lead to illnesses due to birth or even death. My project will help a maternity waiting room in Liberia that is sponsored by the Links Organization Incorporated. I will be sending lightweighted items to these homes along with a few water filters for the mothers to use after they leave the homes. To start my project, I thought it would be important for people to know how most of these mothers and children can get their illnesses. This will be through the water they drink on a daily basis. So I interviewed Ms. Kara Hadley, an engineer who went to Bolivia to do research on getting clean water to the outer villages. I interviewed her to get a better idea on why it is so important to have clean water and ways to make clean water in smaller villages in Africa a reality. So, based upon your experience in working in less developed countries, what is the importance of clean drinking water?
Well, basically, clean drinking water, of course, is important for health purposes. If you don't have clean water to drink, you're going to have a lot of problems with being able to function and live a normal life. With my trip to Bolivia, basically, less developed countries don't have as many resources as we have here in the United States. So therefore, their health care is much less, their quality of food is much less, the quality of life is a little less than here. So clean drinking water is needed so that they can be healthy and live healthier lives. When you ingest intoxicated water, which in less developed countries there's a large population of E. coli within the feces, which gets into the water. Also in the less developed countries there's less education, so therefore the citizens are not knowledgeable about their living habits and how it affects the water that they drink. And so in one of the cities that I went to in Bolivia, called Pedro, is a really small city, about 1,000 people. Some of their habits, such as burning trash on the side of the street every day, watering their crops with dirty, contaminated water, which is their sewer water, which is the only source of water that they have there, really took a toll on their health, and a lot of people were getting really sick, especially children. They're more susceptible to sickness. So ingesting that water really kind of affected the families, and you have to take care of your kids, that's more money, and then of course, like I said, they don't have the resources to take care of their children, to be able to take them to a hospital nearby and get top of the line treatment. So by allowing the people to have clean water and providing those resources for them and educating them about the importance of clean water, they're able to live better lives and be healthier and have a longer living. The biggest barrier is resources, and like I said before, education. On the side of resources, there may not be funding for the communities or the cities to have adequate treatment for their water. So for example, here we have many water treatment facilities where we're able to collect the sewer water, treat it, clean it, so that it's able to come to our faucets in our homes. We can be able to drink it without getting sick. We can water our plants and our lawns without anything dying. So therefore, there they don't have the resources as much, where they kind of take their water and dump it into local water bodies, or they dump it into different land areas so that they can get rid of the waste. But once again, that all comes back to them, because then that contaminated water goes into the aquifer system, and then when they draw their water through the wells or whatever means that they draw their water, pumps, they pretty much get sick from the dirty water. So it kind of recycles into their clean water and makes it dirty. So the resources and having the money and being able to build these adequate systems to treat their water is very important. And that's one of the biggest barriers. And then, like I said, education. A lot of people don't know, especially in less developed countries, they're used to tradition. They're not so open to science and like the new technologies that we have today, like here in the States. So therefore, once you educate the people about the importance of the clean water, the different methods of how they can get clean water, how to test the water to make sure that it's clean, to distribute it to the people so that they can use it for cooking or drinking, is really important. So if we can, somehow educate them and give them the resources and funding that they need to build these facilities, I think that the people in the less developed countries will have a better time to acquire clean water. There are multiple different options that the people in Liberia can use. Basically, they can get national funding from maybe a private organization, or there's a lot of nonprofit organizations here in the United States that can help to get clean water for less developed countries, such as the World Health Organization. They have different programs that can provide funding. These nonprofit or private organizations that may provide funding might help to build water pumps, and what they'll do is they'll have a group of people go over, find a different location within the community or village, whatever the people may have, to drill a hole in the earth so that they can access the clean water in the aquifer. And then they educate the people in the community on how to use this pump, and then also how to fix it, and they provide them with assistance with manuals in their language so that they can know if the pump breaks, this is what needs to happen. And they also educate them about the importance of the clean water, how to know if it's broken, when not to use it. And it's a really good resource for the people. Another option, if they do not have funding or they're not able to get the finances to have a large project such as the water pump, they can also create their own water to use at their personal home, water filters. Basically, there's different sand water filters that they can use using local materials such as a bucket, granulated sand, and then some other materials that they can get from their local area to help to filter the water that they have so that they can be able to access clean water that way. And then there's other advanced water filters that they can also get.
The next segment of my project was the importance of clean waiting rooms and the impacts of the African countries in related to child immortality rates. To get more insight on this subject, I interviewed Dr. Marilyn Fudge, an OBGYN at Bayfront Medical Center, to explain why it is so important to have a clean environment and the proper tools when a mother is giving birth. What is the importance of having clean delivery rooms?
Well, I think that one of the things that we've learned throughout the course or the history of medicine is that it's important to have sterile technique in any procedure or any type of surgery that you're performing. If you look at the history of the history of OBGYN, or even the history of medicine, I think it was like in the 19th century, doctors used to just check patients. They didn't wear gloves, and they would check from one patient to the next patient. There was no hand washing or any of that, and so there was always this question of infection and what was happening. And then somewhere in the 19th century, we realized that hand washing was very important to prevent infection or the spread of infection to patients. And so I think that that kind of fosters or leads into the idea that we need to have clean delivery rooms, use aseptic technique or sterile technique, and it's basically to prevent the spread of infection from either patient to patient. When we're using instruments, they have to be cleaned appropriately, or even and doctors wearing gloves to prevent any infections that we may have from on our hands from being transmitted to a patient, because not using those techniques leads to a higher degree of mortality in terms of infections, and which women can either become very ill from or perhaps die from, as well as their babies. I think that access to health care is important in terms of, if you look at infant mortality rates by countries, you have some of the countries that really have limited access to health care tend to have some of the highest rates of infant mortality. For example, I think and I know in the last few years, I'm not sure if it is for this year, but Afghanistan was one of the countries that actually had one of the highest risk or highest rates of infant mortality. And part of that issue, I believe, is related to just how women are treated in that country. Women are not allowed to have access to, certain health care, prenatal care, and that kind of access tends to lead to having babies that are either women were dying during childbirth, or the baby was dying before it was born because there was limited access to care. In countries where care is more readily available, and in the United States it's not United States, the healthcare is more healthcare is more available for women that are pregnant, and that hopefully in turn leads to some decrease in our significant decrease in our infant mortality when you compare that to a country like Afghanistan, or even some of the African nations where there is like double or triple digit infant mortality. Access to health care basically helps to improve mom's overall health. I think that even though we have a higher degree of access to health care in the U.S., we have not been able to diminish our preterm delivery birth rate, but I think the overall, one of the things that has happened with the access to health care for women in this country or in countries, more developed countries like the U.S., is that we have definitely been able to improve rates of maternal death and perhaps even neonatal death or infant death rates. So that's important, because although we can't prevent some things, we can at least diagnose them earlier and then manage the conditions better. Well, I have not been exposed to deliveries in other less developed countries, so this is based on information that I've read or seen, in literature. In the United States, delivery conditions are very sterile. Here at my hospital, obviously, we have several what we call patient care or patient safety initiatives, quality improvement measures that help to deal with infection control and patient safety in terms of making sure that aseptic techniques are followed. And I think in most developed countries there are what we call quality improvement measures that help to prevent and limit infection. So in our delivery rooms, obviously, and throughout our hospital, hand washing is a major protocol, meaning that you're washing your hands prior to examining a patient and also after you've examined the patient. You're also, at the time of delivery, you're using sterile gloves, sterile instruments, and other sterile techniques to ensure that mom is not infected. We obviously have more access to antibiotics when they're indicated in the delivery setting. In a less developed country, most often those types of quality quality assurance measures are not followed, or they're not part of the standard of care. And in some instances, women may be delivering at home without such aseptic techniques are followed, or they may even be delivering in a hospital setting, in a what we call a hospital ward, where there's several women being delivered in that setting, and there's no, there may not be clean water to provide adequate hand washing. There may not be sterile gloves. There may be gloves, but may not be sterile gloves. And then also, if there's no clean water, then if you're doing a surgical procedure, even if you do a vaginal delivery, you're still maybe using instruments to sew any incisions or any lacerations that occur. Or if you're doing a C-section, you're obviously using surgical instruments. And if you don't have clean water, then you can't obviously have clean instruments or clean techniques, which increases your risk of infection. And infection obviously increases the risk of mortality. Well, here in the U.S., and I would assuming at most institutions at our hospital here, we are a high-risk referral center. So all of the other outlying areas, when they have a patient that is high risk, they're referred here to our hospital because we take care of high-risk pregnancies. And by high risk, I mean things such as moms that have high blood pressure in pregnancy, moms that have diabetes in pregnancy, maybe moms that have already seizure disorders or other cardiac or heart issues related to not even being pregnant, something that was existing prior to pregnancy, or maybe something that's acquired during pregnancy. We also take care of other high-risk conditions such as any type of fetal abnormalities that are detected at the time of ultrasound on a baby. And so many a times those women are transferred here to our institution to deliver here because we take care of high-risk pregnancies and to care for babies that are born to high risk with high-risk conditions such as any fetal anomalies such as heart defects or what we call gastroschisis or bowel defects, because we have a children's hospital here with pediatric surgeons and pediatric neonatologists that can care for those babies. And in most academic or other places, I guess metro or high risk areas around the country, they have those same types of facilities. In lesser developed countries, I think the issue is number one, as we've talked about, is access to care. And if you already have a mom that's compromised or has some other health care issues, there is a strong likelihood that she may not be able to receive adequate prenatal care for her condition or for her high-risk condition, which leads to an increased risk of mortality for her and for her baby. And then if she does make it and delivers the baby, then there is the problem of who's going to care for the baby, or how does the baby receive the type of surgery it needs to survive, or whatever care is needed in order to help the baby get through the neonatal or the infancy period during that first year of life. So I think that in the U.S. we have obviously more advantages in terms of being able to care for high-risk pregnancies as opposed to the lesser developed countries who actually probably struggle to just care for the normal pregnancy, and the high-risk pregnancy is just something way beyond what their scope of training can be. Several years ago, or a couple years ago, I watched a special and we were talking about China, which the infant mortality rate is not so much in China when you compare it to Afghanistan or some of the other lesser developed countries. But even in China, when you live out farther in like some of the rural provinces, the access to care in high-risk situation is access to care in high-risk situation is very limited. And in that particular documentary, there was a couple that I believe had twin daughters that were born way out in one of the rural areas of China, and so the parents literally had to make a choice as to which baby they would be able to have transported to one of the high-risk centers more in the metro or the city areas in order for that child to receive care. So essentially it boiled down to the fact that they were making a choice as to which baby would survive. Mm-hmm. They had to pick to see which baby would survive because they did not have the expense. They were not able to cover the expenses of having that baby transported to be cared for. And I think that that's a very common issue in a lot of lesser developed areas, that number one, they may not have the resources like Bayflight or some of the health helicopters that can provide transportation to the high-risk centers. Or even if they do, the question is who is going to pay for that, because the government doesn't pick up the funding, and unless you are a wealthy individual, then you will not be able to provide that type of care for your newborn baby. Yes, I think that model is, I was recently reading about a model very similar to that, where organizations are providing clean birthing kits to countries in Africa and some of the less developed countries. And the purpose of the Clean Birthing Kit is so that at least if a woman comes into a hospital or comes somewhere to deliver, they will at least have access to clean instruments, and some aseptic technique will be used. And I believe that that's the concept behind the laboring homes or the birthing homes, is so that these women are not delivering hopefully in rural areas where there's no access to clean water or clean aseptic techniques. And so that's another step toward providing access to a somewhat better health care and hopefully improving or decreasing their infant mortality rates in their country.